Hello, Dr. James Bogash, expert in health and longevity, and today we're going to talk about heart disease, heart attacks, which despite everything that we throw at it is still the #1 killer pretty much across the globe. Always has been, probably always will be, until we start realizing what the causes are and how our choices determine it. So genetics, I'm not a big fan of genetics for heart disease. You have similar genetics raised in a similar household lifestyle, you're going to get the same outcomes. That's not a big surprise. But for a long time there, we were really focusing on cholesterol. It seems like that whole focus is not as important as it used to be. We've really started realizing that cholesterol really wasn't the factor. Just because we have a drug that lowered cholesterol didn't mean it was the answer to everything. Again, despite all the procedures, despite all the drugs, it's still the #1 killer. So we are clearly, without a doubt, missing something. And inflammation driven by lifestyle is likely the underlying key. Because dietary choices that drive inflammation probably also drive increased cholesterol. And cholesterol doesn't do damage until it gets damaged from things like inflammation and oxidative stress. So before I get into this study looking at inflammation and plaquing, we need to talk about vulnerable versus stable plaques. A lot of times people, what I've always said is somebody could leave a perfectly fine, healthy stress test and drop dead of a heart attack, leaving that test. It's because stress tests just look for, is the heart getting enough blood flow to function properly? Imagine a blood vessel and we've got a plaque in there and it's perfectly fine, all the blood flow is getting there, but what if that plaque is what's called unstable? We can look at something like a thin cap atheroma where the tip is thin and all of a sudden that breaks off and we now have what's called a thrombus. It's a loose body running through the blood vessel. Maybe it was this big in the blood vessel and then as we go down, all of a sudden it's enough to block and cause severe blockage, ischemic damage, and many times death. So looking at that plaque is way more important than looking at whether or not the blood gets enough heart. I mean, it's part of the stress test is part of the category of testing we do, but really determining that plaque and changing that plaque is what's important. When we look at the plaque, we can look at things like I've always been a big fan of the lipoprotein-associated phospholipase A, also known as the plaque test. It gives us an idea of how stable these plaques are or are not. And in this study, so going back to this particular study, it was a paper presented at the American Heart Association's annual symposium. And they found that there was a very strong association between markers of inflammation like high sensitivity CRP, C-reactive protein, and the presence of those thin cap atheromas. So more inflammation, more problems. And that's where it all stems from. We're not talking about giving anti-inflammatory drugs. We're talking about an anti-inflammatory lifestyle. Less refined carbohydrates, more healthy fats, less unhealthy fats, exercise. All of these things that are the key to managing heart disease or not getting it in the first place. And that's where we've missed. We don't promote the lifestyle changes. We promote the drugs and the surgery and things like stenting, so like percutaneous coronary intervention or PCI, or worst case scenario, CABG, so coronary artery bypass grafting. And those are not fixing the problem. This is a systemic problem happening everywhere in the body, and it just happens to have a local manifestation where we go in and we put the plaque in, or we put in a stent, and we're high-fiving each other, and everybody's like, yeah, we did it, but we didn't fix anything. All we did was put a Band-Aid on a blood vessel that was going to be a problem. We need to address lifestyle if we're truly going to affect heart disease, or just accept that we're not going to change things, and heart disease will forever be the #1 killer, especially when things like viruses that are prone to create inflammation in the blood vessels are want to do. So, as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.